This is Benguet Province in the north of Luzon. Small villages dot the mountain ridges. Here in the town of Bugias in Benguet Province, the Saturday market is crowded with people from nearby villages. Away at the back is the Rural Health Unit. Being close to the market, it is always full of people.
I come from near beside the barangay here. I like here because the doctor here is good.
I think, sir, they are satisfied with the services we gave them.
Since a decentralization policy was implemented in the 1990s, local governments have faced many difficulties in providing good health service to the people. But here in Benguet Province, measures to improve the local health service are already underway. Let's see what's happening in Benguet. Benguet Province is 250 kilometers north of Manila in the Cordillera Mountains. Terraced fields cover the mountain slopes. The Rural Health Unit is the medical health service closest to the people. Decentralization meant its operation was transferred from the provincial government to each town. It was difficult to maintain good quality service and work in close contact with hospitals in the region. To overcome the difficulties caused by disrupted services, a new system was adopted. It's called Interlocal Health Zone. It is one of the 4 policies in the government's healthcare reform policy, Formula 1, and it aims to improve health administration across town units. Neighboring towns and the base hospital form a zone. They devise a system to cooperate and share resources, such as personnel, facilities, and funds. The aim is to improve the quality of the health service. One of the systems under the Interlocal Health Zone is the Common Health Trust Fund. Local governments contribute budgets which are pooled as a trust fund to improve the health service. Here in Benguet, the province contributes funds in addition to the fund from the town. So how is the trust fund established? First, in consultation with accountants and cashiers at the town hall, the operating system and guidelines of the fund are worked out. Discussions follow about each town's contribution, how the fund should be used, and how the records should be kept. A memorandum of agreement is then signed, and each town adopts resolutions regarding the appointment of fund managers. Once the resolution is adopted, the Common Health Trust Fund is established. When medical equipment is needed, an application is made to the fund. Then it is considered whether the equipment is for the common use of the zone. For instance, medical equipment which could not be bought with the town budget can be bought and managed as common equipment, or medicine can be bought in bulk to lower the cost. These are some of the merits of several towns cooperating. Also, patients who cannot be cared for at the rural health unit can be sent to the base hospital in the interlocal health zone to receive appropriate care. This is Abatan Emergency Hospital, the primary hospital in the Mount Trail zone of Benguet Province. The office of the interlocal health zone was set up next to this hospital.
When we started with the interlocal health zone, each one was trying to get a part of something just for his facility. So unlike for now, with the establishment of the Common Health Trust Fund, at least we could move around and have different projects, and we did also development of this, just like our interlocal health zone office.
Even without its knowing, or was already preparing Benguet to be mainstream into what the whole DOH wanted to go now, the Formula One for health.
JICA implements Japanese government development assistance and has been supporting the project of improving the healthcare system in Benguet Province.
We
at JICA have always said we're ready to support those who make the effort themselves. We've been constructing systems, including capacity building and training people. These are JICA's areas of special expertise. Plans, achievable goals, and targets differ from country to country. But we felt that if we approach the problems in this way, output will always follow.
This project is implemented under the framework of Formula One, the healthcare reform policy of the Philippines. It has 4 main points for improving local health services. Improving the healthcare capacity at each level, provinces, interlocal health zones, and towns. Improving financial and management capacity and improving healthcare finance by promoting health insurance coverage. Providing training so that rural health units can be certified providers of health insurance and improving health service by constructing a patient referral system. And improving the system of supplying medicine with the aim of procurement based on inventory control. Let's see what has been done in Benguet Province with regard to each of the 4 points. To improve the healthcare system, improvement is required in the capacity of the province, interlocal health zone, and the towns.
First is continuous monitoring of the activities through the provincial health office. I told the doctor that you should meet your municipal health officers at least monthly, so that we will be informed of what are their needs, what are they doing. The national government, the provincial government, so that they will be informed, so that they will react on this. They have to react.
We have to come up with a program that we cluster, so that the other government who has more funds can support us. So I think the reason why this interlocal health zone was organized is really very helpful. Previously, all government were focused on infrastructure program, but now we are changing that principle of giving of budgeting, that we have to give a bigger share to our health programs, because we believe that a healthy people means a healthy nation.
How far this service can benefit the interlocal health zone, not just us, not just for Benguet, but also for the nearby provinces that we also cater. So From there, we learned that through the interlocal health zone that we can really share resources.
Needs-based budget planning calls for evidence-based planning. The plan is based on the number of patients, the number of cases, and other data. This is useful in operating the interlocal health zone effectively. When the province, interlocal health zones, and the towns work together, limited resources can be managed efficiently. This is Benguet General Hospital in La Trinidad, the capital of Benguet Province. Near the entrance is the temporary desk of PhilHealth, the health insurance corporation. This is to encourage patients and their families coming to the hospital to enroll in health insurance.
We were also able to give orientations and trainings to our field partners and to our LGU and stakeholders, other stakeholders, specifically the trainings and orientations on the National Health Insurance Program and a special training on community organizing for the field workers, especially the midwives, the barangay captains.
The project gives support so these desks can be set up in hospitals, rural health units, and even villages. The aim is to improve healthcare finances. If a rural health unit is certified as a health insurance corporation, it can be paid dividends called capitation fund, according to the number of insurers. It can also receive refunds from the insurance company according to the health service it has provided. Kibungan is a small town in the mountains, more than 3 hours by car from La Trinidad. Since the project was implemented, this rural health unit has received support from the government and its working capital has improved.
We did not have enough budget to cover all the necessary activities or fund all the necessary activities that time. We were able to coordinate or have some influence our officials to make some priority in our health budget, and we observed that it has increased because we were able to hire additional personnel to implement the programs, the project, and our users fee, we were able to collect from 2006 to now. It has doubled from 52,000. We were able to reach 144,000. And we also have increased our financial status by means of the capitation fund. And we owe it to the increased enrollment of our PhilHealth enrollees.
A better medical environment is being created by the Common Health Trust Fund, income from health insurance, plus extra income from the effort of each rural health unit. A hotel in Baguio. Training for general pediatric disease management is underway here.
Okay, so nandyan yung 2 interventions natin.
20 midwives from various places in Benguet Province have come to get training.
See a patient and the skills, including the attitude,
I want to be more comfortable and more assertive in the service.
So we will learn much if we will return and apply it to our constituents. So we will have a healthy community.
They have to complete a curriculum of 11 full days to get a PhilHealth certificate, a health insurance corporation certificate. Training is practical, and this will help to improve the quality of health service.
Because of those so many clients that come, we've thought that we must be a Sintrong Sigla facility in order that we can provide good services to our people. And with that, with the packages we receive, soon came the PhilHealth. So with our PhilHealth reimbursements, the capitation fund, it's also the one who helped us improve our facilities. In our municipality here in Bugyas, we have so many private practitioners. So, and we have two private hospitals. With that, we develop an interlocal health zone, including those private, through referral system.
Obtaining the Sintrong Sigla certificate and PhilHealth certificate is directly linked to improving the health service. To meet the special needs of the region, each interlocal health zone makes its own manual for referring patients. This improves the patient referral system and enables serious cases to be treated quickly. At the Atok Rural Health Unit, the system for supplying medicine is better than it used to be before the project.
Okay, so this is our stock room where we put our drugs. So before, when the project is not yet here, the drugs are all piled in cartons, of which it's just everywhere, which is not so organized. But now you can easily take it out because it is well labeled and it is well fixed. Output of the project is we have here the stock cards of the available medicines. So all the medicines that are here in the stock room is put into folder for the stock card, so that in the stock card we can monitor what medicines are available and what medicines are not available. And also, if we have the stock card, we put what are the medicines that are being brought out and the medicines that are still here in the stock room. So it is very easy to monitor what are the medicines that are available and not.
When the project came, this project, we were taught that in order to have good plans, we have to make it evidence-based. When we show something to our chief executive, because she's the one who approves our budget, we have to explain to her that, for example, our drugs. So for the past years, maybe we were having about 200,000 budget for medicines and other services as well. But by using the evidence, we have to show them that for this year, we have spent this much on medicines. However, the utilization for these medicines shows that we lack some commodities.
Strict management of the inventory at the Rural Health Unit enables drugs to be supplied efficiently, necessary drugs to be stocked, and quality service to be provided. The medicine management data is also useful for bulk purchase at the interlocal health zone, which helps to keep costs down.
It improved a lot, no? First, in the creation of the interlocal health zones, there was already harmonious relationship among doctors, among mayors. So, like for example, the Mountain Trail interlocal health zone, yeah, they conduct meetings regularly. So I even attend, maybe once or twice I attended their meeting.
The governor arrives at Benguet General Hospital. Today, a conference is being held here, bringing together all health officials, doctors, and those working in the healthcare sector. This is the meeting of the technical working group of the project. It is held 4 times a year. Matters resolved here are deliberated at the executive committee, consisting of governors and mayors. Then the approval process begins. It is an important meeting to reflect the views of those working in the healthcare sector in government policy.
Sit down with your mayors at mayors so that the mayor should know what are your needs, so that once we will meet with the mayors, they will be informing us, and then I will also be informing them that, okay, this would be our scheme. Look, like for
the governor's stance is to listen to the voices of the people himself to identify the needs of the healthcare service. This has given support to the project in Benguet province. In the 2-day meeting of the technical workshop group, activities and problems in each zone were discussed, and conditions and measures were shared.
And also for the municipalities.
On the back of the jackets worn by members, it says, "Unite for Health."
So for Bukod RHU, PLGU.
The success of this project is contributed much to the willingness of the involved participants, involved party.
I think we need to focus on sustainability. After the project ends, we have to have mechanisms in place so that the partnerships will continue for the better health outcomes, better healthcare financing, better service delivery, and better regulation in health.
Bakun in Benguet province. An ambulance arrives at the rural health unit. A boy with kidney disease was not doing well, so the ambulance was sent out from the base hospital. The patient is 10 years old. His condition did not improve with drugs or a drip, so they decided he needed treatment at the base hospital. It is an hour and a half by car from the rural health unit to the base hospital. The common use of ambulances is made possible by the interlocal health zone. In other interlocal health zones, the cost of gas and driver's pay are also paid for by the trust fund.
in order to succeed for our health programs, we have to be united. We have to be united.
Before, really don't have this interlocal health zone. Right? So, and I was not that much aware, or I was aware of it, but I was not much included, or I was not very active that time because I'm more on the clinical part. But for this 10 months experience with the interlocal health zone, I can say that it gives more quality health service. Because sometimes if I need something, or we need help, we can always you can always call to Doctora from the RHU. We have communication, like for our referrals, she can refer here, and then we make the communication. Maybe I think that gives better and quality health service.
Take it from us, the Benguet project is serving as a model for the other provinces of the Cordillera. Pretty soon, we are sending many of our own provinces to see what is going on in Benguet.
Maybe for them to have a hands-on management on health services. They should know what are the needs of the people, and then from there they will be able to take off. Okay, so once they know the requirements of their people to the rural health units, to the district hospitals, then they could now prioritize allocation of funds. Of course, allocation of funds is very important.
Towns sharing resources and uniting for the sake of a better health service. This vision is already being practiced successfully here in Benguet Province.